Well, welcome back, everyone. You've probably gotten a heart checkup, a flu shot, and for the ladies, a mammogram. But when is the last time you got your bones tested? Taking a closer look, according to the Mayo Clinic, most people reach their peak bone mass around age 30. Weak bones means you're likely to develop osteoporosis, which causes bones to become weak and brittle. That's why you need to consider undergoing a bone density test. And here to tell us about how a new test works here in Austin is Dr. Michelle McDermott with the Austin Diagnostic Clinic. Good morning to you.
Good morning.
You've got brand spanking new technology, still putting the machine together.
Yes, we have new technology. It's actually new software that will be loaded onto a bone density scanner that we are currently using. And what this new software will do will give us additional information about patients' risk for fracture. So osteoporosis is a condition in which patients have low bone density and also poor bone quality. It's a deterioration of the bone. Our current bone density technology tells us about how much mineral is in the bone. That's called bone mass. And that's helpful, but 50% of patients who have fractures that can be very debilitating do not have low bone mass. So this new technology called trabecular bone score tells us about the quality of the bone, whether there's been deterioration or not. So we can detect whether a patient is at risk for fracture even if they have normal or only slightly low bone density.
And so you guys are getting this machine ready. You're going to be rolling it out to patients starting this month. I think we had some video we were showing earlier about how it works. So a patient lays on a table and the machine essentially kind of scans over their body. How long does it take?
It's very quick, just minutes, and the results are available in seconds. So this technology doesn't add any extra time to the procedure. It's done at the same time as the bone density scan is done. And it's very minimal x-ray, hardly any, similar to if you were to fly in an airplane from New York to Los Angeles.
Do you think this could become a more normal thing? I mean, obviously now it's going to be reachable for Central Texans to be able to get this test, but does insurance cover it? Is it a pretty common thing in other parts of the country?
It's not common in other parts of the country. It's very new, and so far insurance isn't covering it yet, but just like any other new technology, once we can demonstrate the benefits in terms of preventing events like fractures, being able to intervene early, I think that the insurance companies will recognize how we can save money by preventing patients from having health problems like a fracture.
And I was kind of shocked about the numbers that we reeled off at the beginning. Age 30 is when you can start seeing some deterioration of your bones, which is past 30, so that woke me up a little bit. What are some things that people can do to keep their bones healthy and prevent osteoporosis?
There are a lot of things, and that's a great question. So the main thing is to be active, because our bones respond to stimulation. So sedentary people lose bone faster. So it doesn't have to be weightlifting. It can be walking or cycling, yoga, Pilates, any kind of active exercise. Gardening is even a good form of exercise to stimulate your bones. And then all women older than age 50 need calcium in the amount of 1,200 milligrams, younger than that 1,000 milligrams, and then men who are older than 50 also should have 1,000 milligrams of calcium. Vitamin D is important. Many of us work indoors and we don't get a lot of sunshine, or we put sunblock on, so vitamin D of 800 to 1,000 units is recommended for everyone.
Perfect. If you're not getting it in your diet, then think about
a multivitamin.
Okay, and the last but not least, this new machine, are people already on the waiting list? How can someone find out more information about it?
Yes, well, we're already sort of telling our patients, if you're due for your bone density, let's wait until we get this new technology, because we do have patients where we really want to know this information, because it'll make a big difference, especially for patients who have arthritis or are on steroids, conditions where they have reasons to have deterioration of their bone, but the bone density test might not tell us about that. So yes, they can talk to their doctor about this. The Austin Diagnostic Clinic Imaging Center is where this is going to be done. The Austin Diagnostic Clinic Bone Densitometry. It'll be at our main facility. So they can check in on our website. It's a good place to check in about that.
Perfect. Yeah. Thank you, Dr. McDermott. And we're going to have information and link to that on our website at KXAN.com. Thanks for being here this morning.
My pleasure.